My name is Robert Lerrigo. I am a gastroenterologist, just graduated fellowship from Stanford, and I have a special interest in inflammatory bowel disease.
Hello again. So I was hoping you could talk a little bit about uveitis. I heard from a non-gastroenterologist that it's best treated with anti-TNF biologics. So I just wanted to get your thoughts and
Yeah. So uveitis, so with inflammatory bowel disease, one of the great things about inflammatory bowel disease is that it can affect organs outside of your gastrointestinal tract, outside of your colon, outside of your small intestines. It can affect your skin, it can affect your eyes, and rarely, I think I read 0.5% to 3.5% of IBD patients, they can develop what's called uveitis, which is inflammation within one of the compartments within the eye. Typically, we treat it with, well, it's the eye doctor that treats it. It's the ophthalmologist that treats this first and foremost. So if it's detected by your gastroenterologist, they immediately refer you to an ophthalmologist. But typically, it's treated with steroids. That can be ocular steroids, right on the eye. But in more severe cases, patients need systemic steroids, so they give them oral steroids that get in the blood. There are other types of therapies that people can consider as well, particularly if it's more severe. Cyclosporin, I've heard being used, infliximab. Sometimes people use a combination therapy, a biologic agent with something like Imuran, for example. And then there are other medicines that the ophthalmologist can give you to help reduce pain related to the uveitis as well. Those are called cycloplegics, and that's just for symptom control directly to the eye. Patients with chronic uveitis who persist for longer periods really can require longer-term immunosuppressive therapy, because you don't want to be on steroids for a very long time, particularly repeated courses of steroids or just daily long-term use of steroids, because that can cause a lot of side effects. So to avoid those side effects, we use other medicines like the biologics or like drugs like azathioprine, immunosuppressive drugs like that, to help with the uveitis.